Can telehealth monitoring miss masked hypertension in young adults? Imagine trying to catch a sneaky pattern in your blood pressure that only shows up when you're busy or stressed. Sometimes, blood pressure looks normal during a doctor's visit or at home, but it's higher during everyday activities. That's called masked hypertension. It can be tricky to spot because standard telehealth methods mainly relying on patients measuring their blood pressure at set times. These measurements might miss the times when blood pressure spikes, like during exercise or stress. Telehealth usually involves patients using automated blood pressure monitors at home and sending the results to their healthcare providers. While this makes tracking easier and more frequent, it has limits. For example, home blood pressure readings are often taken at specific times, like morning or evening, and might not reflect blood pressure during physical activity or when feeling stressed. These are moments when blood pressure can be higher, but they might not be captured. There is a more detailed way to catch masked hypertension called ambulatory blood pressure monitoring. This involves wearing a device that automatically checks blood pressure every 15 to 30 minutes over 24 hours, including during sleep. It gives a full picture of how blood pressure varies throughout the day and night. However, ambulatory monitoring is less common in telehealth because it requires special equipment and more setup. Young adults tend to have more fluctuating blood pressure because of lifestyle factors like stress, diet, and physical activity. This makes it harder to relying on just a few home measurements for an accurate diagnosis. If a young person's home readings are normal but they have risk factors or symptoms, their doctor might suggest ambulatory monitoring or in-clinic assessments. Telehealth can still be very helpful. It allows for more frequent check-ins, medication reminders, and lifestyle coaching. But it's important to remember that it doesn't always catch everything, especially masked hypertension. Combining telehealth with other methods like ambulatory blood pressure monitoring or periodic in-person visits helps ensure no hidden issues are missed. For young people using telehealth, it's best to use validated blood pressure monitors and follow proper measurement techniques. If readings are normal but there are concerns, discussing the possibility of ambulatory monitoring with a healthcare provider is a good step. Telehealth programs that include education and coaching can support healthier habits and better blood pressure control. In the end, telehealth is a great tool for managing hypertension, but it's not perfect for detecting masked hypertension on its own. Being aware of its limitations and working with healthcare providers to get comprehensive assessments helps young adults stay on top of their health and avoid missing hidden high blood pressure.